Hi there, Corazon volunteer. This is Catherine Eichmann, the co-chair of Corazon Clinic, and in this video, I'll be demonstrating a second chart example. This example will be a little bit more complex than the last example in that it covers a wide variety of complaints. Most cases are pretty straightforward, but some of the cases you'll encounter look very similar to this. So let's go ahead and get started. So again, here we have our blank chart. Please make sure that all parts are filled out. If you have a question about a section, please do not hesitate to ask one of the board members or providers. So first off, in our chart, we have the left-hand side, which is the patient demographics. We're going to make sure that the medical record number is recorded on there. And then we're also going to make sure that the patient's name is on there. In this case, we have Jane P. Doe coming in. We have today's date or the date of service. The patient's date of birth, please make sure that this is verified when you see the patient or call the patient back into the room. And then we also have their gender and then their reason for visit. And if you're an admin, please remember not just to put refills, but try and state what the conditions are of their chief complaint and then indicate that they need refills. So in our chart example here, we have Miss Jane P. Doe coming in for hypertension, type 2 diabetes, knee pain, anxiety, and allergies, and she wants refills of her medications. So before we start on the HPI, we want to make sure that we check their problem list, so be sure to look in the medical history in the separate page on the chart to review this. And then you want to ask them about insurance status and their allergies to medications, food, or substances. So if they have insurance, please circle yes and state which one. In our case, the patient does not have insurance, so we'll circle no. We check their problem list by looking at their medical history and medications. And then we want to ask them if they have any allergies. In this case, our patient has no allergies, so we would circle none. But if they had an allergy to penicillin, aspirin, latex, or sulfa drugs, we would circle one of those. Okay, now we can move on to the subjective section, gathering the HPI. Remember that the chief complaints are hypertension, type 2 diabetes, allergies, anxiety, and knee pain. So a lot of different concerns here. So what information do you want to gather from this patient? Remember that you are an investigator and you're asking them questions. So in your HPI, you would want to list the chronic conditions that they have concerns about, along with the intervention that they may be doing for that condition, such as a list of medications, what they're indicated for, and their doses. You also want to indicate when the last dose of medication that they took. This does several things for us. First, it assesses for compliance, and it also tests for efficacy of the medications. This is very important because oftentimes our patients lose their medication and miss doses. So if they haven't been taking their medication for about a month and their blood pressure is elevated, we wouldn't want to prescribe another agent to bring their blood pressure under control. Instead, we would just want to ensure that the patient takes their medication so we can assess for efficacy of the medication. So oftentimes it's just putting patients back on the same medications and ensuring that they're taking them. Next, we want to know if the patient feels subjectively better or worse with that intervention, and most often this is medication. And this mostly pertains to pain medications, allergy meds, psych meds, steroids, antibiotics. So note that not all of the meds will elicit a physical change in sensation, such like as blood pressure or diabetic medications. Most patients aren't really aware that these are working unless they actually measure their blood pressure or blood glucose on a regular basis. Next, you want to ask some review of system questions, which will give you insight on the status of their condition. So in this case, I would ask about the 3 Ps, polyuria, polydipsia, polyphagia for diabetes. I would also ask about numbness and tingling and nausea and vomiting for diabetes. For hypertension, I would want to inquire about chest pain, shortness of breath, heart palpitations, any kind of lower leg edema, changes in their vision, blurry vision, and headaches. And then I would also want to ask them about, some anxiety symptoms like worrying, panic attacks, trouble sleeping. And then for allergies, I would definitely want to know if the allergy medication that they're using is working, if they're having lots of runny nose, if they're having shortness of breath, cough, sneezing, those kinds of questions. So since this is a diabetic patient, you want to take their blood glucose. So you want to know if they're fasting or non-fasting. If they're non-fasting, which means that they ate, you want to ask when the last time that they ate and what they ate. Next is a tricky thing to ask, and that is if they have any new concerns. And you may not always want to ask that because it can take you down a rabbit hole, but I ask this on a case-by-case basis, as some patients can have a laundry list of complaints, and we may not be able to get to all of them in the visit due to time constraints. So if they do have any complaints, just ask them to pick their top concerns that you can focus on during that visit. Other information that you want to make sure that you review is old data such as prior psych sheets and psych assessments, as well as review the blood pressure and blood glucose chart, and making sure that you review the trend of their blood pressure and blood glucose. If their blood pressure or blood glucose is all of a sudden really high when it's normally kind of stable, ask yourself why. Ask your patient why. What has changed? Did they forget a dose of medication? Are they more anxious? Are they fasting versus non-fasting? What is that difference? And make sure that you document that. This is a question that Bill, the PA, often will ask of us. Hey, make them go look at the trend, ask them why that this value is a lot different than what their normal values are. So these are just some pieces of information that you want to gather in the HPI. In the next slide, I will show you a narrative of a chief complaint such as this. So here's the example of the HPI from our patient with a long list of chief complaints. Remember that if you want to document this on a separate sheet of paper and transfer it over, you can, or you can document it in real time. The more experience that you get, the better and the faster that you'll be at documenting the HPI. I typically will go out, gather the HPI, memorize it, and take a couple notes and then go back inside and write it, but that is going to come with lots and lots of practice. Remember that the HPI doesn't have to be perfect, but it should document the most important aspects of the case. So here's the HPI of our case. So I have written this. Patient is a 52-year-old female who presents to follow up on hypertension, type 2 diabetes, seasonal allergies, anxiety, and chronic left knee pain. Her current medication regimen includes lisinopril, 40 milligrams once daily, and hydrochlorothiazide, 12.5 milligrams once daily for hypertension, metformin 500 milligrams twice daily for type 2 diabetes, buspirone 5 milligrams once a day for anxiety, Zyrtec 10 milligrams once a day for allergies, and ibuprofen 400 milligrams PRN or as needed for pain. Patient requests refills on all meds except for Zyrtec. Last doses of medication were taken yesterday. She reports mild shortness of breath with exertion, headaches, mild bilateral leg swelling, and numbness and tingling of her bilateral feet. She denies polyuria, polydipsia, polyphagia, nausea and vomiting, chest pain, dizziness, and blurry vision. She does not self-monitor her blood glucose or blood pressure. Patient is non-fasting. She ate pancakes with syrup and fruit for breakfast about an hour and a half ago. She reports pain relief with ibuprofen and reports that buspirone helped her anxiety at first, but recently she is feeling more anxious and is having panic attacks. I put that in quotation because she states that it's a panic attack. We don't know what it is. She worries about her situation on the street, and she fears that she will never be able to get a job. During these attacks, she reports heart palpitations and some shortness of breath. She also reports trouble sleeping as she ruminates on thoughts, which keeps her awake. So this is just an example of the HPI, and next we'll go ahead and move on to the physical exam, pulling out some of these pieces here and making sure that we examine them ourselves, like the leg swelling and the numbness and tingling of her feet. We also want to listen to her lungs because she has some shortness of breath, and also listen and auscultate her heart because she has the heart palpitations. So here's our physical exam section. This is again where we're going to document our physical exam findings, and make sure that you always have this filled out in its entirety. Don't leave anything blank. But first we have general appearance. So this is just assessing how the patient presents in office. So in this case, we're going to imagine that the patient presents with mild distress and anxiety. Patient becomes tearful when speaking about anxiety. So remember, this is something that we're observing. If they're in distress, please put it. If they're normal and calm, please put in no apparent distress. Next is the neuro section, and again we document some psych components here, but also some neurological things as well. So in this case, the patient is alert and oriented ×3, and since it's not ×4, we want to specify what she's not oriented to. So we put not oriented to time. She does not know the day of the week. Also, we did perform just a really simple neuro exam by looking at her sensation of her lower extremity, and the sensation of the feet is diminished to light touch bilaterally. We could do some more in-depth physical exam for the neuro section, but we're just going to keep it simple for this example. Next is the gastrointestinal system. We didn't feel the need to perform that, so in that case, again, we don't want to leave it blank, so we're going to write detailed exam omitted, and in parentheses DEO, so for any other exams that we're going to omit, we can just write DEO. Next is the musculoskeletal section. Since she's having pain, we do want to go ahead and just assess the knee. So she has some lateral joint line, the lateral joint line of her left knee is tender to palpation. There's no effusion or swelling present, and there's no evidence of trauma. You could also do some more physical exam and special maneuvers, but for this example, we'll just keep it simple. Next, gait posture transfer. This needs to be done at every visit because you can just easily do it by looking at your patient and assessing them. You can also see them walking as well, especially when you call them back to the exam room. So in this case, her gait and station is intact. You asked her to walk and it wasn't antalgic or it wasn't ataxic, it was completely intact. So you would put gait and station intact. Next, for the HEENT exam, we are going to perform this because she has allergies. So we're going to look in her eyes, in her nose, and her throat. So here are exam findings here. She has mild bilateral conjunctival injection with cobblestoning of the posterior pharynx, present with some postnasal drip, but no exudate. The sinuses are non-tender to palpation, and her cervical lymph nodes are non-palpable. This could also be stated as no lymphadenopathy. Also, looking in her nose, her nasal turbinates are mildly edematous. So this kind of looks like a more seasonal allergic picture. Next, for the respiratory exam, since she was having some shortness of breath, and she also has hypertension, we want to listen to the lungs. So when you auscultate, you hear mild wheezing, auscultated in the posterior left upper lobe, otherwise CTA or clear to auscultation of the remaining posterior lung fields. Definitely, since she has hypertension and diabetes and also anxiety, we want to listen to the heart. So she has regular rate and rhythm. There's no murmurs, clicks, or gallops. You go ahead and look at her feet since there's some swelling, or you look at her pretibial region and her leg, and you press on that region, and she has +1 pitting edema bilaterally, and you also feel her pedal pulses. They're present, but kind of hard to palpate, so that is a +1 or a 1+ pulse, and that is bilateral. Next, we have the skin exam. She has normal skin color and texture. No lesions are present. So that's what the physical exam would look like in its entirety. Again, please don't leave any sections blank. We also want to make sure that we document and take the vitals. So we take her blood glucose, and it is postprandial or non-fasting, and it is 230. Next, you take the blood pressure, and it is 150/88. Heart rate is 84, respiratory rate 14, temperature is 97.6, so she's afebrile, which reinforces our HEENT exam, that it's more allergies rather than infection, and then her pulse ox is 97. So since this patient has a mental health concern of anxiety, we want to review her past psych assessment. And this is what our psych assessment looks like. It is a blue sheet of paper that has a series of questions on it. You want to perform the psych sheet with every single new patient that comes to the clinic, 6 weeks after starting a new medication, adjusting a medication, or giving a new diagnosis. And then if they are stable, you want to perform a psych sheet every 3 months just to assess for efficacy of the intervention, which again is normally a medication. So let's just say that we are going to review the patient's last psych sheet. You give this to the patient and ask them to circle the statements that they resonate with. So we're looking here and we look at her past psych sheet, we notice that she has 10 total circles and no asterisks, meaning that if she circles a concern or a statement that has an asterisk next to it, we want to document that. So this last psych sheet was taken a couple months ago, around 3 months ago, again had 10 total circles. She was diagnosed with anxiety and given a medication, and then she had really no big concerning symptoms. So now, since she states that her anxiety is getting worse and it has been 3 months, we want to re-perform the psych sheet. So we would give her the psych sheet and ask her to go ahead and circle any statements that she resonates with. And so this is what she circled, so a lot more than 10. So this time she circled 17 statements, and 2 of those were asterisks. And if we look at the asterisks, what are they? They are going to be trouble sleeping and trouble falling asleep. So these are more sleep complaints rather than some of the big ones like suicidal ideation or suicidal thoughts, or just the intent to harm others. It's still concerning. So we would calculate those all up, put down the total 17 with the asterisks, and go ahead and present this to either Bill or Susan, who is our psychiatric social worker. So after you've taken the HPI, perform your physical exam, check your vitals, and also perform the psych sheet, you can now go ahead and present to your provider, and they will help you with the assessment and plan. So let's go through our mini assessments here. These are chronic conditions that she has, so we can already assume what the provider will assess her with. So you can make a list somewhere else just so you have an idea, but wait for them to give you the assessment. So in this case, we have hypertension, and it is uncontrolled. She's on 2 hypertensive agents. And still her blood pressure is not controlled. We want it to be under 130/80 or 130/85, and it is 150/88. So she is still uncontrolled. Next is her diabetes type 2. It is also uncontrolled. Even though that she was non-fasting, we want her blood sugar to be under 180 non-fasting, and it is not. It is above 200, so we would say that's uncontrolled. Next, she has seasonal allergies, generalized anxiety disorder that has worsened, left knee pain, and some neuropathy, which is that numbness and tingling that she described and that you tested on physical exam. You can assume that this is diabetic neuropathy just because neuropathy does go hand in hand with uncontrolled diabetes. So you can just put a DDX underneath that says diabetic neuropathy. So now for the plan, you are going to refill lisinopril and take 1 tablet by mouth once a day for high blood pressure for 7 days. And you're also going to add in a second agent, which she already was taking, the HCTZ, but you're going to increase the dose. So since you're changing the dose, you want to put start instead of refill. If it was refill, it would be the same dose, but since we're increasing the dose, you're going to say start. HCTZ 25 milligrams, take 1 tablet by mouth once a day for high blood pressure and leg swelling for 7 days. So this HCTZ should help the blood pressure and also her swelling too. Next, we have our diabetes, so she's going to increase the dose of that now from a total of, I think it was 1 gram that she was taking a day, now to 1.5 grams. So the SIG will look like this. Start metformin 500 milligrams. Take 2 tablets by mouth in the morning. So that's a total of 1 gram in the morning, and 1 tablet in the evening. So that's a full dose of 1.5 grams for diabetes for 7 days. For seasonal allergies, since she already has enough Zyrtec, we're not going to refill it, so you can just put continue. This tells the pharmacy that they don't need to refill it. She's just going to continue it. She has the medication, but you still want to write it out in its entirety. Zyrtec 10 milligrams, take 1 tablet by mouth once a day for allergies. So for 4, the provider wants to adjust the dose of the buspirone, so we're going to say start. So start buspirone 5 milligrams, take 1 tablet by mouth twice a day for anxiety for 7 days. It was previously once a day, but now they're going to add in a second dose and make it twice a day. Next, for the knee pain, You'll prescribe ibuprofen, and that'll be refill ibuprofen 200 milligrams. Take 2 tablets by mouth every 4 to 6 hours as needed for knee pain. And we're just going to dispense 21 of those instead of putting a duration for 7 days. And then lastly, there is neuropathy, and the provider wanted to start gabapentin, 300 milligrams. So you would write start gabapentin, 300 milligrams, take 1 capsule once a day for neuropathy for 7 days. So that's what the assessment and the plan would look like. So since we adjusted several of the medications and that requires some monitoring, I would write in the notes section just a little note to tell the next team what to do, what to look out for. So in this case I wrote, hypertension, type 2 diabetes, and anxiety remain uncontrolled despite therapy. Doses of HCTZ, metformin, and buspirone were increased. Gabapentin was also prescribed due to numbness and tingling, likely diabetic neuropathy. Please continue to monitor blood glucose and blood pressure weekly to assess for efficacy of medication. Please follow up with Susan next week for anxiety and perform a psych sheet in 6 weeks to follow up on anxiety and her medication. And then I also circled the feet since their numbness and tingling were in the feet. And then, of course, before you finish that chart, you better put your provider names on it. So in this case, let's just say we consulted with Bill and Susan. Myself and John were the volunteers. We were in room number 4, and we want that patient to follow up in 1 week to reassess how things are going for them. Again, this is really important that all of these are filled out, so if we have questions, we know who to ask. So here's that chart filled out in all of its entirety. We have our demographics at first and the chief complaint. Next, we have some other notes about the insurance status, the problem list, and also the allergies. Then we have our HPI, followed by our vitals, making sure that those are completely filled out. Then we have the physical exam. All of that is filled out. There is nothing that is left blank, and all of the pertinent physical exams were performed. Next, we have the assessment that you consulted with the provider, and those are all documented here. Quite a big list of them. Sometimes this can be 1 to 2 things, up to 8, 9, 6, 7 different assessments. And then also the plan. Sometimes this can be a little bit lengthy too, and it is lengthy here. So we have the full plan of all of the medications that we are starting, refilling, and continuing. Then we have our notes at the top to please assess them at the next visit, monitoring their blood pressure and blood glucose, because some adjustments to their medications were made. Also, some new medications were also prescribed. And then last but not least, we have our provider names, Bill and Susan, our volunteer names, our room number, and our follow-up time. So this was a little bit more of a complicated or robust case. Like I said, we have a few straightforward ones, and we have some of cases that are quite intensive, just like this. Some of these, sometimes this can be overwhelming. Just remember to keep organized and do your best. If you need to take notes on a separate sheet of paper and then copy it, that is fine. But over time, you'll just get better and better at this. If you have any questions about anything covered in this example, please let myself know or one of the board members know. Thank you so much for your attention in this chart example. Again, if you have any questions about the material covered in this example, please let myself or my fellow board members or a provider know.